Hey, this is Erin, your friendly ER educator, and today we're going to talk about debriefing after trauma and why we should be talking about our feelings and then thinking about, what went well, what didn't go well, and what we could do better for our practice next time. Going through this presentation, we're going to look at how trauma affects us physically, mentally, emotionally, etc. We're going to look at some normal coping mechanisms. We're going to take a peek at why workplace trauma can affect us differently, because we know that in healthcare it can certainly affect us differently than the average person. We're going to review the benefits to debriefing after trauma. I'm going to give you some recommendations for debriefing, looking at different tools, scripts, checklists, and then we're going to understand, lastly, what to do if you're still struggling with trauma after the debrief. All right, so to kick us off, I want you to do a little self-reflection. Everybody has that one code or that one trauma or that one patient that they will remember for a lifetime. And I want you to think about that. I want you to think about why you remember it. I also want you to think about a really good code that you had or a really good trauma that you had. Why was it so good? What went well? And then I also want you to think about maybe one that didn't go so well. And it doesn't necessarily just have to be a bad patient outcome. Just, we all have those times where you have a really chaotic code or a really chaotic trauma, and I want you to just think about, why was it chaotic? What didn't go well? And we're going to look at some things that kind of contribute to making things good and making situations bad, and we're going to do a little reflection on that later, but I just want you to think about just some things that you've experienced in your practice so far. When we looked at the objectives of the course, we were going to talk about how trauma affects us. And we also wanted to look at the fact that trauma can affect healthcare workers differently than it affects the average person. So when a lot of us think about trauma and critical incidents, a lot of us might think to ourselves, well, it's just part of the job. And to be very fair, it might be, but it does affect us differently. So let's look at some statistics. So these are just staggering in my opinion. But 80% of first responders have experienced traumatic events on the job. Okay? 50% of all healthcare workers have experienced trauma on the job in the last year. And 85% of those, or greater than 85% of those people, have had stress-related symptoms due to that trauma. Okay? So when we think about workplace trauma exposure, it could be a sudden death, it could be incidents involving children, it could be a trauma with serious injury, it could be abuse of a healthcare worker, but really it's really any threat to any individual's physical or psychological safety and well-being. And it's important to note that following trauma exposure or critical incidents, an individual can experience multiple emotional, mental, and physical symptoms that impact their well-being. So as we can see in the statistics, it's very common that we are exposed to workplace trauma. We also can see that many of us will have physical or mental emotional symptoms that impact our well-being and potentially can impact our patients' care. So let's keep this in mind as we start to look at how this can affect us more. Thinking back to some anatomy and physiology, or just going back to nursing school, we know that stress affects the body in many ways, right? So physically, we know that stress is going to raise our cortisol levels. It's going to cause us to have changes in vital signs. So when a person is stressed out or in pain, we know that we're going to have a faster heart rate, faster respirations, our blood pressure might elevate. Stress can also cause headaches, GI symptoms. I don't know if anyone ever gets stressed out enough where you're running to the bathroom to have some diarrhea. It can cause sweating, heart palpitations, muscle tension, right? We feel that in our necks and our heads, muscle tremors, and just flat out exhaustion if you're, repeatedly seeing the same stress over and over and over. Psychologically, it can cause anxiety, depression, anger, fear, flashbacks to the incident. I don't know how many times my very first code, I actually replayed that code over and over and over in my head, and then I dreamt about it, and then I had to talk about it, and it was just over and over and over. Some people have nightmares or paranoia. Some patients or people or healthcare workers might have difficulty concentrating. They might completely dissociate where they're not making connections with anyone else in their life. They're just kind of pulling back and just not trying to associate. They're just kind of having this disconnected feel. And some might even have suicidal or homicidal ideation. And we know this, right? We've heard about people, we might even know people that have had post-traumatic stress and they've become suicidal or homicidal. And we've certainly seen healthcare workers, first responders that have been suicidal and who have reached out for help. And we've also seen those that just struggled with it a little too much, and unfortunately they've taken their own lives because of it. Emotionally, we might see, some of this within ourselves or in our coworkers, but again, that feeling of detachment, avoidance. I definitely have worked with people in the past where we had a really bad pediatric code, and it was someone that our coworkers had known. It was another coworker's child. And for a while, there was a few people in our kind of group of nurses that didn't want to even come back to work. So they kind of avoided the ER. They avoided coming to work. They needed to take some time off. And when stress is really high, we will often see people try and avoid places, people, or situations, especially if the work environment could put us right back into that situation again. Some people might just, again, dissociate. They might feel numb to the situation. They might feel numb to their life, where they're just not having any emotion, good or bad. Certainly, stress can cause agitation, anxiety, sadness, confusion. You might notice mood changes, loss of sense of self, hopelessness, shame. And certainly people might try and cope with that using addiction or other at-risk behaviors. The last slide, we looked at how stress affects our body. Now we're going to take a look at some typical coping mechanisms. Typically, when a person has stress, the amount of stress and the amount of feelings and the amount of response that we have is going to be dictated by a few things. Our response to that stressor is going to be influenced by other things that we have going on in our life, previous coping mechanisms, if we've ever dealt with that type of trauma or stress before. Like, you have your first code. Well, it can be certainly more stressful the first time because you've never dealt with it before. But the more experience you get, the more codes you're involved in, the less scary it is, right? You might process it differently. When we look at typical coping mechanisms, there's kind of positive and negative ways to deal with stuff. So positive, a coping mechanism could be talking to others. Like I said earlier, when I had my first code, I replayed that in my head 1,000 times, what I could have done better, what I could do for next time. I talked to my charge nurse. It was a lot. My poor husband had to listen to me 1,000 times talking about this dang code, right? But talking to people, and sometimes you might even need to talk to a neutral third party, and that's okay. Talking to a therapist is just fine. It's also positive to express our feelings, and we're going to talk about that coming up. Nutrition and good exercise are good as well to making sure that we're keeping our physical self healthy. Indulging in some self-care is important. Go get a massage, get some acupuncture, go get a pedicure, something to engage in self-care. Seeking support is important. Humor is important, as long as it's not too dark. I mean, we all work in the ER, right? So we don't want it to be too dark, but humor is important. And then coming up with ways to problem solve and work on it for next time are also positive ways to cope. Some negative things would be bottling up our feelings, not talking about it, not asking for help, suppressing our feelings, because eventually it's just going to blow up and boil over. Self-medicating with substances or alcohol is not the best option. And then certainly denial and some self-blame are probably not the best and most positive ways to deal with stress. So why does workplace trauma affect us differently for those of us that are working in healthcare? Well, anyone who's worked in healthcare recently can probably attest to some of these things, right? The population is changing. There are sicker and sicker people every day, which is giving us a more complex patient load. In critical situations, we often act in survival mode, and it isn't until afterwards where we start to process things. We also know, working in the ER, that we work in a very fast-paced environment, and oftentimes we are expected to go right back into patient care, which again puts us at a little bit of a disadvantage because we can't process that. Anyone that's worked through COVID knows what it's like working through a pandemic, right? Under-resourced systems, units. We maybe don't always have the best staffing, best patient ratios. We can certainly get overwhelmed in our ER, depending on how many patients walk through the door, right? And every situation and set of staff are different, and that is not in our control, right? I'm sure there's some coworkers that you would love to work with and run a code with, right? Kind of your own little A team that you think about in your head. You know, those people that you can always kind of count on, that are experienced, that know what they're doing, you know, things just kind of go smoothly, right? You just anticipate each other's needs, right? But if you're working with a different set of staff that maybe you aren't used to, that can certainly be a hindrance sometime. We already know that nurses are already dealing with burnout, stress, and moral injury, and a lot of us have trauma from our own personal lives, and sometimes that gets exacerbated during times of stress while we're on the job. So does workplace trauma affect us differently than the average person? Absolutely, right? It's not normal to see trauma all the time. It's not normal to deal with stress all the time, but we do, and so we need to make sure that we're taking care of ourselves. So when we think about trauma and the fact that we deal with it often, what can we do? How do we process it? Well, you can either address it or ignore it, right? So following trauma, exposure, or critical incident, we know that we can experience multiple emotional, mental, and physical symptoms. We've already kind of hit on that. So what's recommended? We can either debrief after traumatic incidents, or more frequently if needed, we can seek out therapy or counseling, or potentially even consider a different career move if this is something that we're still struggling with. So next up, let's look at debriefing recommendations. So what is debriefing? Well, debriefing, the term or the concept, really started in the aviation world and the military as a process for safety management and process improvement. The first documented information regarding the use of debriefing in healthcare started in an emergency room in Scotland. And if you look at any sort of current recommendations, the American Heart Association, when you think about doing codes and CPR and ACLS and everything like that, the AHA has actually been recommending debrief since about 2010. But to be honest, we haven't seen this a lot. When I was working at the University of Minnesota for a long time, we never did a debrief. It wasn't actually until I came to Westfield where we actually started doing this. I've already been a nurse for 11 years. So this is not something that I think is in current practice everywhere and everybody's doing it, but we definitely should be. In healthcare, we know that debriefing is a process of communication between team members following a clinical case. And according to the American Journal of Managed Care, debriefing is a practice that allows caregivers and survivors time to process and reflect on traumatic events that they've experienced to help gain personal control over the incident. So in doing some research about this, like I said, there wasn't a lot. We know that debriefing is something that is absolutely recommended, but the fact that we've only really been doing it for about 15, 20 years isn't great. And maybe it's just not been documented. That might be. But we know that the benefits of debriefing allows a safe space for staff and leaders to share feelings, and it kind of helps us facilitate discussion of the team to look at successes, opportunities for improvement, safety concerns, and the potential for deeper staff intervention if people need it. Now, one thing I did find that was interesting is that it's recommended that debriefing occurs shortly after the traumatic event to increase effectiveness, no later than 24 to 72 hours after an incident. And really what I found is that we should be debriefing before the end of the shift, sometimes even before you resume patient care, if possible. The reason we want to do that is we want to make sure that we're engaging everybody that was involved before the end of the shift, so we can really highlight what went well, what we need to improve on, etc. It doesn't make sense to debrief with people that weren't even there, right? It's also a good idea to debrief before you resume patient care if possible. Now our ER can't shut down, so we can sit there and debrief for a half an hour. But for those that are really struggling or maybe need to take a step off the floor, it's important that we do this right away and as soon as possible. So if people need to take a step away, we can intervene and do that, so it doesn't slow down the flow of everybody else and everything else that's going on in the department. So just keep that in mind, that the sooner the better. So what are some benefits of debriefing? Well, we know that teams that regularly debrief perform better than those who do not. And I will say, since I, again, have come to Westfield and started working here in the ER after codes, I will say Dr. Suri is amazing at doing debriefs, and I have completely changed my practice. And if she's not around, this is something that I encourage all of our doctors to do. I just think it opens up communication amongst the staff members and increases our communication. And I think it's really a good idea to just talk about what went well, what didn't go well, and what we need to look at for next time. Another benefit of debriefing, we can address immediate safety needs. I will say that when we debriefed, one of the times when I had very first started working at Westfields, one of the things that we had picked up on was some changes with our code cards, and not necessarily changes across the valley, but we had recognized that we maybe didn't have all the equipment that we should have had. And did it really impact patient care? No, but when we were looking for something in the moment, it certainly could have slowed us down a little bit to not have what we wanted or thought was readily available. Another benefit of debriefing is it can certainly give us, some insight to change our practice or maybe even equipment. So if a piece of equipment isn't working well, or the providers are really wanting something else, this is a great opportunity to be like, hey, this isn't working. Maybe we need to bring this forward. Is it something where we need to include pharmacy? Do we need to get a different dose of medication, or do we maybe need this in our code kits? Something like that. Debriefing from an education standpoint is also really good because it highlights the need for future educational opportunities. When we get into these high risk situations where we don't do them very often, it's not uncommon for people to kind of forget what they're supposed to do. And that's okay, right? That's all right. That's normal. But if it's something where it's like, well, gosh, we went to go put this arterial line in and nobody knew how to do it. Well, in a really high risk situation where the patient is critical and we need to put this in, we need to know how to do it. So for me, it offers me the opportunity, or affords me the opportunity, to provide some extra education. And debriefing often will have a lot of benefit if it can be recorded. And I'm not saying you put this in the patient's chart. We absolutely don't want to do that. But it could be something where we just, kind of put some information down on a sheet of paper so we can review that and we can send that off to DOM or managers or whatever to do some just, highlighting what went well, what didn't go well. And especially if there's equipment issues or somebody is struggling, that might be something that we'd want to implement as charge nurses going forward. All right. So again, I was blessed to work with Dr. Suri, and this is something that she does with her practice when we do debriefing. So when she was running the debrief, and it doesn't always have to be the physician, it could be the charge nurse, or it could be like the primary nurse who is ever kind of in charge of working with that patient the most. And really anyone can run the debrief. But this is just kind of what we call a stop for 5 tool. And we're going to look at 5, the components to this and why it's called stop for 5. But these are just some things that I have found doing research on what we could potentially include in our debriefing form. Okay, so when we're thinking about running the debrief, and again, this is something that Dr. Suri had done, and I just absolutely fell in love with it, and I would like to see us continue doing. But she starts off the debrief by thanking everybody for being present and encourages everyone to participate. One thing I absolutely love that she does, especially if the patient did not survive, to take a moment of silence to honor and recognize the patient. And then she often will say things like, the debrief is for educational purposes and it'll just kind of helps us communicate. It's not for blaming, it's not to penalize, and we don't record names or anything like that. So who's ever in charge of kind of running the code, or the charge nurse, or whoever the primary nurse was, or whoever was, mainly involved in this case, you have someone just summarize the case. Okay? And it doesn't need to be start to finish, like the patient has a history of this and this. You want to just kind of summarize what happened in that moment, maybe some events leading up to that. It doesn't need to be super long, just a few minutes. And then you look at things that went well during the care of the patient, opportunities for improvement. What could have gone better? Was there good communication? Did you have all the equipment that you need, etc.? And then you look at points of action. Were there any safety concerns? Does anyone need anything prior going back to work? And I love this one. Dr. Suri does this. Does anyone need anything before going back to work? Do you need help with a death packet? Or do you need help with paperwork? Or do you need to take a minute out in the ambulance bay to collect yourself? Whatever. And I would say, as the charge nurse, this is really important too, to make sure that you're checking in with your people, to make sure that everybody's processing okay. And if they're not, do you need to send somebody home? Do you need to get in touch with the manager? Do we need to refer someone to the workplace services that we have? And we're going to touch on that in a little bit too. So when you think about stop for 5, they say it should be about 5 minutes, but the stop is just kind of a nice acronym to kind of just get you to think about things that you should talk about during your debrief. So when you're doing the stop for 5, these are just some tips to help with a good debrief. So have everyone start off with introductions, introduce themselves and their role in the department or role in the case. This, I think, is really helpful too when you've got people from ancillary departments like RT or lab or house supervisor, or maybe OB came down to help, whatever. Just have everybody introduce themselves and kind of their role in the case, as well as, what part of the hospital they're in, etc. Then in a couple of minutes, again, summarize the case, relevant medical history, possible causes, the patient's presentation, and then just a generalized course of treatment. Then you want to kind of get into the feelings part of it. How did it feel? What went well? And this is a great opportunity to call out good teamwork, good leadership, good communication, good dynamics. Try not to focus on the interventions like, hey, that was a good IO, or hey, you did a good job putting an IV in, or hey, you did a good job intubating. Try not to focus on interventions, but more so on teamwork and leadership and communications and how the group did as a whole. Then you want to talk about what could have gone better. And sometimes this is hard. You want to try and allow all the members of the group to discuss problems related to the case. You want to focus on team dynamics, again, communication, leadership, and efficiency rather than medical management. So instead of saying, hey, that intubation sucked, or you couldn't get that arterial line placed, you could say things like, the environment was really chaotic. No one had clear leadership. There wasn't a clear leader. The communication was not closed loop, so there was lots of sidebar conversations. So focus on those things. And then lastly, what would you do differently in the future? How can we improve as a group? Is there anything we can change our future practice? And lastly, summarize the debrief, including future group or improvement goals. So if it's something where, man, our communication was not good, we didn't have closed loop communication, this would be an opportunity for us to say, hey, we need to work on closed loop communication. We need to work on keeping the room silent so we can have direct conversations, etc. So these are just some tips for a good debrief. So just kind of asking it out loud. And again, I worked for 10 years before I even saw a debrief. And this is not something that we typically did at my old job. The one time that we did it was when the 35W bridge collapsed. And it was mandated that we did some debriefing. But there was not any sort of debrief process that we did on a day-to-day basis. So I want you to just kind of ask yourself, do you currently debrief? Do you like the process? And is there anything that you can do to improve upon your process? I would hope that working in our ER, you feel like you have the support that you need, but there are definitely times, and it hits everybody different, right? We could all be in the same code, and for whatever reason, that code could impact us differently, and that's okay. But we would hope that you would all feel supported. And if you don't feel supported, we need to know about that. And that's something that you can bring forward to your manager. We also want to make sure that staff are aware that if you're still struggling after a debrief, and while it can be helpful, it does not prevent post-traumatic stress disorder, and it does not prevent psychological repercussions of trauma. So it's important that whoever's running this debriefing should alert the staff that it's possible to have reactions that may surface in the coming days, weeks, and months, and that symptoms can vary, and that's normal and expected. However, if you're finding that symptoms are interfering with your daily life and work, then staff should be referred to the workplace or private means of therapy and our employee assistance program. We should be engaging in self-care, and staff should feel comfortable speaking with the debrief team leader, their peers, or managers if symptoms are not resolving so they can receive the help that they need. The last thing we want you to do is struggle. And if you're finding that, things are kind of getting stirred up after the debrief or after the incident, and you're not able to manage that on your own, that's okay. We want you to come to us for help, and we will certainly get you in touch with resources. So in conclusion, my recommendations to you about debriefing is 1, please, please, please take care of yourself. No one else will. If you're not currently doing debriefs into your shifts or after trauma or after codes, please start doing it. It'll help you process trauma and hopefully find solutions for improvement within the department. And then lastly, like we just talked about, please reach out to your charge nurse, your peers, your manager, someone if you're struggling so we can help you get the resources that you need. Because we think everybody is a valuable member of the team and we want to help you if you are struggling. So these last 2 slides are references. I hope that you learned a little bit about debriefing and how stress affects us and just some methods for debriefing so you can work that into your own practice. And then again, just recognizing how this affects us, how stress can harm us physically, emotionally, spiritually, psychologically, everything, so that we're aware and we can debrief appropriately. And then again, if you're struggling, you can get resources.